Hi everyone, Dr. Emmy from Pain Free and Fit. Today, as per viewer suggestion, we're going to be going over how to sit and seated modifications in terms of the seated position for those with low back spondylolisthesis. Hope you enjoy. So choosing the right chair and learning how to sit when you're not in your favorite chair are important self-help methods to take care of your lower back spondylolisthesis pain. To begin, let's review and make sure that we understand that spondylolisthesis is typically, not always, but typically aggravated when the curve of your lower back, the lordotic arch, is increased. When the lordotic arch is increased, the tailbone comes up and the pubic bone lowers. And that's pelvic tilting. Even in the seated position, you can roll your pelvis back and forth, and with your hand in your lower back, you can feel that arch increase as you lower your pubic bone and raise your tailbone, and you can feel that arch decrease when you tuck your tail under and let the body typically slump. Now, although most people with spondylolisthesis are aggravated when that arch increases, it's important to find out what your neutral spine position is in relation to pelvic tilting. And remember, a neutral spine is unique for each and every person. It takes into account not only pelvic tilting, but if you need to hold one hip slightly down, the rib cage tilted to one side, a rotational correction of your typical posture and movement habits, all based on the fact that we all have our own muscle imbalances from years of asymmetrical postures and movements, and we need to know how to put our spines into a neutral or safe position so as to reduce the stress on the soft tissues, the discs, the facet joints, the muscles, ligaments, nerves that come out of the back. So in terms of pelvic tilting, we'll just take one facet of that neutral spine positioning. If you tilt your pubic bone down and raise your tailbone up, at a certain point you'll probably notice a little increase in back pain or your symptoms. That would be one extreme. You'd stop there and then you'd tilt the tailbone under, flattening the arch of your back until you feel perhaps a little pulling or stretch or maybe even irritation. Stop there. That's another extreme. You want to position your arch or your pelvic roll, your pelvic tilt, halfway between those two extremes so that it's at a midpoint, the furthest point away from either too much tilting irritates or too little tilting or flattening of the back irritates. That would be your neutral position in terms of an anterior, posterior, or front to back pelvic tilt. Once you're in that position, you'd want to choose a chair or a lumbar arch support that holds your arch and your pelvis in that position. Now, typically, what you'll want to do is you'll want to make sure that the cushion that fits into your back, whether it's part of the chair or if you take a separate cushion or towel, you want to make sure that the size of that support fits the hollow in your arch right against the back of the chair so that when you're sitting up, you are in that neutral position. That's the safest position to reduce pressure on your discs, on your facet joints. Spondylolisthesis many times is irritated with increased arching because it has a tendency to cause that vertebra to slide forward more. The stresses going forward are going to stress the facet joint and the disc in a way that's going to create pain. But when you're holding it in that neutral position, it decreases those forces. Supporting that, of course, is the height of your chair. The higher up your chair, the more that arch is going to want to increase. The lower the chair, conversely, the closer to the floor your buttocks are, and the less of an angle between your thigh and your torso, that's going to decrease the arch of your back. So sometimes you'll be in a chair, perhaps, that doesn't have a perfect lumbar support. You'll want to either build that chair up the height of it or decrease it so that you can feel that arch. If you have a chair that moves up and down, you can simply keep your hand in your lower back, increase the height of the chair to come up, feeling the increased arch, decreasing the level of the chair, you'll feel the back flatten. Same thing can be done in terms of a footstool. If you have a footstool or something like a book you can put under your feet, if you're sitting in a chair that you're not used to, let's say a different office, a different situation, elevating even your heels up a little bit under a support will help increase that arch, while flattening the heels will help to decrease that arch. The other thing you want to keep in mind is the effect of hip flexion on spondylolisthesis. From long periods of sitting and fetal postures, sleeping on your side, many people with spondylo have tight hip flexors. Those are the muscles that connect your leg basically to your pelvis and spine, and they help to flex or move the leg upwards. Unfortunately, tight hip flexors have a tendency to increase that arch of the back by causing a compression between the low back and the hip. So one of the things we can do when we're sitting to decrease that tightness in hip flexors is we can choose a chair without armrests coming to the side and allowing one of our legs to drop off. This helps to open this angle between my thigh and my torso, which decreases the compressive or shortening effect of the hip flexors. And when I'm practicing that over time, that will hopefully decrease the stress on my lower back after many hours of sitting. If I have the option to sit in a chair that allows my legs to go forward like this, that's another way of decreasing. Now here I have bilateral, or both sides decreased. We have chairs on the market that you can get without sides that allow you to sit in a more upright posture. Of course, the further the leg goes down, though, make sure it's not changing your neutral spine position in terms of pelvic tilting, because as that leg comes down, it's more likely to increase that arch. So you may have to then incorporate a little chair height lift, decrease to take that arch off, depending on circumstances. So get used to first pelvic tilting and figuring out where that mid position is in the seated position that's most comfortable. And then you're going to build your chair positions and your body positions around that to help support a neutral spine, decreasing pressures and irritations on your low back spondylolisthesis. If you like this video and would like to learn more tips and exercises for spondylolisthesis, feel free to subscribe to our channel. Got a lot of great videos out there to help you. Questions or comments, as always, write in. I'll do my best to answer. And remember, if you're looking for a great home program to figure out what your unique posture issues are, what your unique mechanical issues are that are affecting your spondylolisthesis, and how to build a exercise program around that to support a neutral spine and to decrease the stress in your spondylolisthesis and assist your body to heal your low back pain, check out our fast track program for spondylolisthesis available at painfreeandfit.com. I hope this video on seated spondylolisthesis positions helps you with your chronic lower back pain.